This is COVID, a weekly show addressing all of your questions in our community about, guess what? The situation that we're all in. COVID 2020. But we are going to address these questions weekly with you, with all of our experts, the epidemiologists, doctors, and experts in the field. So send us your questions and subscribe to our channel, and stay tuned. Well, thank you guys for being here. Dudley Carr, the creator, the developer of the contact tracing app, COVID Trace, and Tim Robb from Health and Human Services, right? So. Yep. I really want to start this interview. First of all, thank you both for being here. You know, we have Dudley over in Seattle, so we appreciate, you being here with us. But can you tell me a little bit about the story? Because I love stories. How did this all come to be with this COVID Trace app? Because Nevada is what? One of the first states that's being released in?
I think we're number 4.
Number 4?
Yep. I think Dudley was actually engaged in the process a little bit before I was, so I don't know if maybe he wants to start with how he got involved.
How did you get involved, Dudley? How did this come to be?
Yeah, no, it's a great question. So my brother, myself, and another gentleman named Josh Gummersall, in March, we found ourselves with a little bit of spare time, and we decided to actually think about how we could apply technology to help with the fight against COVID. So we, just like a number of other people, realized that we could potentially help with contact tracing, and our focus was actually to build an app in a way that actually preserved people's privacy. At the time in March, it wasn't clear that that was the direction that contact tracing was going to go, and so we invested a lot of effort to prove out that concept. So we worked day and night, and sometime in April we were in a place where we thought that we could roll out the app, and then we immediately ran into roadblocks launching it on the Apple and Google store for very good reason. It became clear that we had to work with the Department of Health, and so we started reaching out to various departments of health over the next couple of months. And it was actually because of a story published in an online blog called GeekWire that Andrew Pascal from Nevada, he's the CEO of Play Studios, he found out about what we were doing, and so we started a discussion with him about the suitability of what we had developed for Nevada. And it's actually through his guidance and connections and introductions that we finally got connected to Jim Murin, who's heading the public-private task force in Nevada, and then of course ultimately with Tim and Julia at DHHS, who've really led this effort in the deployment in Nevada. So it's been an incredible ride with meeting a number of people, but yeah, that's how we got here.
So Dudley, we were talking about how you and Tim and everyone came to be, and I'm a big believer that things happen at the right time, and nothing is a coincidence. And I do feel, in talking a lot more to Tim here, that he is definitely your champion. He's the right person to kind of get this rolling. So tell us a little bit about what your involvement is with the app.
Yeah, so really, I don't know, when I got involved with the app, we wanted to make sure that the experts had something to put into the app as well. So a lot of the exposure notification criteria were developed through them, and the relationships that I've built over actually just the COVID response with those people. So yeah, we worked really close with our chief medical officer, state epidemiologist, other epidemiology staff, and executive type people to make sure that this app was going to fill our need, but also had Nevadans in mind, and made sure that they were going to be able to do this as private and securely as possible. So.
Mm-hmm. And you, and I'll have to ask this because I want to kind of represent the community, and everyone's question is, well, is it really going to protect my privacy? What kind of information does it share? How does it work?
Yeah, so really there's not much information that we capture out of this app. I mean, it's really just Bluetooth tokens that are completely anonymous and randomized, and it draws in the connection. Dudley might be able to speak a little bit more on the technical aspect of that, but it's really very minimal data. We never ask for your name, your contact information, nothing in this application. It's really just the bare minimum of what we needed to make sure that this app would help protect public health.
So, and I think he kind of threw that back at you, Dudley, and the actual fine details of how it works, because it's just Bluetooth. So the person has to download the app and have the Bluetooth on all the time?
Yeah, absolutely. If you want the app to help you detect exposures, you certainly need Bluetooth enabled. There, of course, are times when you will be in airplane mode, and in those situations, you are not participating in exposure notification. So if possible, it is best to keep that on. I think it's important to realize that this exposure notification functionality builds off of Bluetooth that is both in Android and iPhones. And it's really part of the operating system. In fact, the mechanism to help with this exposure notification, as the app develops, we have limited access at the points when we're transmitting information, but otherwise it is actually locked in your phone. Even those tokens that Tim was talking about that are getting exchanged, those aren't even available to the app. So it's actually super secure. And that's the only information that is passed from one phone to another is completely random numbers that just keep a log of interactions. It doesn't actually know who that other person is. It's not based on the contacts in your phone. It doesn't have any other type of information. It doesn't know whether or not you're ill. It is just this little bits of information to know that you and I came in proximity of one another within 6 feet for a certain period of time, and that is all that it knows.
So the exact purpose of the app from a contact tracing perspective, what would you say it is?
Yeah, so contact tracing in its traditional form is really limited because you need to know the people that are actually around you and a way to contact them if we're going to be successful in slowing the spread that way. It's also a really cumbersome thing that takes a lot of time, a lot of staff time, a lot of people have to be engaged in that process to make it work. So this solution actually helps fill the gap of the people that are actually maybe not your friends that you encounter on just one-time basis. I mean, if you spend, the example that Apple and Google always give is you have a conversation on a park bench with somebody that lasts longer than 15 minutes and that exposure is what ends up getting you sick potentially. So really it's a way to fill the gap in the contact tracing traditional things that are continuing. This is not a replacement, it's just another piece that brings in the anonymity but also is able to identify the potential strangers or something that you came in contact with.
Mm-hmm. So what is being done to let the community know that it's out there? How are you pushing it out there to get the most people to download it?
So we're working with a company called R&R Partners, and they're helping with all kinds of strategies. I mean, we have billboards out in English and Spanish. We have some social media campaigns that are up and running, but also working with a lot of community partners. A lot of the casino organizations and a couple of unions and things are on board with helping us roll this out. So really helping being a champion in the workplace that hopefully will translate into the personal lives of people as well.
I think a big thing that both Dudley and Tim that you said was how quickly this kind of all came to be. So in June, the relationship started, between both of you. So how did we roll it out 2 weeks ago? That's very quick.
Yeah, so Dudley and his brother have been pretty vital in getting this across the finish line and really pushed, and we've been able to push our team to get the answers they needed to get this out as quickly as possible. I mean, this is a potential life-saving application, so the need is there, and it was the right thing to do, so we pushed as hard as we could to get it done as quickly as we could.
Would it have been this quick if you didn't have the private sector working so diligently?
I think that partnership's huge, and really there's no way we could have done it without them, especially at the speed that we produced it. So that partnership was vital in our success for sure.
So a lot of people ask about the application tracking their location. Does it track my location?
It absolutely does not track your location. As we had talked about it before, it actually just uses Bluetooth information. And so Bluetooth is the same technology that powers my earbuds between my phone. And so it's actually just, that whole technology works just on close range. And so if your phone is close to another phone, they can actually detect the relatively weak signals that they're sending out. as opposed to GPS, right, which knows wherever you are. And GPS, although a powerful technology with incredible uses and can be used for contact tracing, has limitations, right? So GPS doesn't work inside of buildings, and so it is much harder to detect proximity. And so even though GPS is on every phone, it is pretty accessible to app developers, it is actually not the best solution for helping with contact tracing and exposure notification. And so we initially started using it, and the stuff that Apple and Google produced that is so much better for this task of doing contact tracing using Bluetooth, we've gone that way, and that there's absolutely no use of GPS in terms of helping with exposure notification.
So I think we've talked about different apps, but why is this particular app better than all of the other apps that are out there?
Yeah, so I think COVID Trace Nevada is very similar to what just recently rolled out in Virginia and some of the other states. It all is based on the fundamental new technology in Apple iPhones and Android phones that is called exposure notification. And that functionality is baked into the operating system. Even if you have it in your pocket and the apps aren't open, it is continually working in the background. And that is hugely powerful. Having the support from both Apple and Google on the vast majority of devices out there ensures that it actually works properly. I think what Apple and Google are also doing, in addition to working with Nevada's DHHS, is that they've worked with epidemiologists across the globe, and they've gotten feedback. And so what we are rolling out builds on top of that, and we've benefited from the guidance and the expertise that they've built into the platform and that they've shared with us as we've developed our application.
So should I do it or should you do it? Just for the sake of our viewers, we say Nevada, not Nevada. And so I know our viewers would just kind of be thinking, well, why isn't someone correcting him? so there you go, Dudley. You learned something new. It's Nevada.
I'm going to do my
Nevada.
very best to say it properly from now on.
We'll help you with that. So we've talked a lot about a lot of different things, but I think in terms of the contact tracing, so once you have contact with the person, how does that look like from the health or from the state's perspective?
Yeah, so when somebody's tested, they are ultimately, if they are positive, are contacted by a disease investigator. At that point, the disease investigator will ask if they have the app, and if they do, they'll get a verification code that will release those keys into the server so they can be compared to see if there's exposures. Once that happens, really the person that's positive doesn't need to do anything else. But the contacts to the positive person will be notified within a couple of hours of that happening, and they will be given a call to action that will say, call this number, you've been exposed to somebody that has tested positive for COVID-19, and then a contact tracer will be on the other end of that line and help them assess what their next steps need to be.
Okay, perfect. So, and I think we talked a little bit about how it was funded, but what are next steps, for this app and the funding? Is it funded through the year, through the end of the year?
So we've had some huge partnerships that have really stepped up in a big way on the financial front and continue to. So I think Dudley may be able to speak a little bit more to the money that's coming to them, but it's been a completely free process for the state. We really, other than staff time, haven't had to put a ton of money towards this. So it's pretty incredible that the private world has stepped up in the way that they have for us.
Right. It is. I mean, I have to say, just watching our community come together the way they have when we were on lockdown, kind of trying to help save our local economy, and now hearing about this contact tracing app and seeing that it's our community that came together. And I know that there's a big Stanford presence here, so I think it's even, very much more incredible that you're from Stanford doing all this. From my perspective, working with contact tracing, and one of my objectives is talking to the Latinx community, getting this information out. Is this app also in Spanish?
Yeah, this app is also in Spanish. So if your settings are set to Spanish on your phone, it'll automatically be in Spanish when you open the app. So.
And then does that mean that the contact tracer on the other end will automatically know and connect with the person in Spanish?
So no, not at this time, but that is definitely something that we're looking into, making that a little bit easier in the transition process for sure.
Excellent. Well, thank you both. This has been incredible. You know, we're just getting going with this YouTube channel, and the main objective with all of this is to address misinformation, to, you know, be a place for the community to feel confident in the information. So I thank you both for the hard work that you've done and you're still continuing to do. So I'm sure that we'll be connecting again, hopefully in a few months, to talk about all of the successes of the contact tracing app. So all of the viewers, please go to makinghealthhappen.org. There's going to be more information on the contact tracing app there and some links, but please download the contact tracing app. It's called COVID Trace. It's called COVID Trace Nevada.
Yep.
Not Nevada, COVID Trace Nevada. Download it today. Thank you both for being on the show.
Thank you for letting us share our story.
Absolutely.
Really appreciate it.
Yeah, thanks so much. Really appreciate it.
Thank you. COVID, your resource to everything related to this situation that we're in. COVID. We're going to have doctors, epidemiologists, and all kinds of experts answering your questions so that we can navigate this crazy world that we're in together with COVID. So please subscribe to the channel, follow us, and we'll make sense of this together.